Hey everybody, this is Chris, Essential Motion Spine and Sport.
Jeff.
So what we wanted to do today was talk to you about the knee. We have questions sometimes get asked to us about, what ligament has been damaged. Was it a ligament? Was it a tendon? How do you know if the knee is, strong and tight? And how do you know if it's loose and injured? So we'll give an example here first, because Jeff actually had a knee injury in the past, football and college, I believe.
Yep. Yeah. Well, 2006, so it's been many years, so it's been like this for a while. It was just a ligamentous injury, so a lot of times with knees, the main things you see usually are, ligamentous injury or meniscus. Those are the two big things. Mm-hmm. So today we're just going to talk about ligaments. So.
Yeah. And so just a little background, a ligament is a tight band of tissue that connects a bone to a bone. So ligaments in our body are there to protect the structure, the integrity of the joint, so that we have not so much motion all over the place. The knee has an inside one and outside one. So an MCL attaches the big long thigh bone to the shin bone. The LCL attaches the big long thigh bone to the shin bone. Actually, let's show it on Jeff's knee. It's easy. Yep, that's up.
Anyway.
So on this one in front here is actually a tendon. We're going to talk about those maybe on a different time, but there's a ligament in through here called your MCL that attaches the thigh bone to the shin bone. And that just means medial collateral. That's all it stands for, ligament. LCL is lateral, meaning outside, thigh bone to shin bone. That stops the knee from doing too much of that motion. So you get like to the side there, that one stops that. The reason that MCL is injured quite often is that when something, like let's say Josh playing football and somebody hits him from the side here trying to tackle him, if that thing goes too far that way, that ligament stops him from going too far. Okay?
Nice stop.
Yep. On the inside of the knee, there's these two that cross, so they're called the cruciates. It's just a word for cross. There's an anterior cruciate ligament and a posterior cruciate ligament. That's where you get the ACL and the PCL words from. The ACL stops the shin bone from moving forward. So when he gets this forward move, actually I'm going to start you back. So if he had a loose ACL, this shin bone would translate forward like that. Now with him, because he has a good ACL, it snaps nice and tight. What he has some laxity in, or some, I guess laxity is the word we use. Yeah. Is the PCL. When I push back, so the PCL stops the shin bone from moving backwards. So when I go that way, it still stops, but you can see that play in the joint. It's kind of like you can see the bone moving. What do you think about that, Jazz? Does that look weird? Does it look kind of funny?
Yeah.
Look at the difference in this one. So this one it moves very, very little. It's very tight. This one has a bunch of play and a little bit of a clunk in it, right, like that. But it's still strong. The end range is still strong. Mm-hmm. So those are the four ligaments of the knee. That's typically what we see and test in the knee. What else am I forgetting to mention on the knee?
Just the the big ones you see a lot are MCL injuries and then the ACL. You don't see a lot of PCLs. They're out there, but they're just not as common.
Essentially, you have to have the shin bone be pushed backwards, right? So how did you get where someone hit you here, or someone where this was planted and they hit you kind of from the back and pushed the thigh bone forward?
So I was fourth column, so I was planted here and I was pulled backwards and my knee buckled.
Okay.
My leg was straight.
Okay.
Went back that way.
Hyperextension. Okay.
But
all right.
Yeah, and a lot of times you see, we call it the vertebral triad. You see the ACL, MCL, and then medial meniscus. Those are three you kind of see all together just by mechanism of injury with the knee itself.
When you see those, it's a pretty classic thing. It usually involves some force, here, and then a rotation. So there's a rotation force to involve the ACL. And as that knee, like if somebody kind of lands and they buckle, then you get the MCL, the ACL deep inside. And then when he says meniscus, that's a little like C-shaped cushion. There's one on the inside here, and there's one on the outside here that there's one thigh bone, and there's two kind of, knuckles? Yeah, knuckles. I don't know what it's called. They're called condyles, but that's what sits on top of those two C-shaped deals where we get our bending and straightening. So when that gets injured, the MCL, that ligament on the inside, has actual attachment to the meniscus. So if you tear that, sometimes it tears a piece of that little cushion as well. And that would not be a good injury when you get what do you call that?
Terrible tear.
Not good.
A few different names for it, but yeah.
And you've seen it on TV if you've watched enough sports, football, basketball. They can either be during contact, or you get those kind of classic non-contact ones where somebody like cuts and plants. They try to they're jumping landing, or they cut and it usually buckles in and down, and then they're holding their leg with it's ACL and MCL. So yeah, I can think of a couple of. I mean, like your old I'm going to be putting myself old now, like Willis McGahee and some of the ones from you just watch them happen, and the whole knee just went. You can just see it bad. So I don't think you know who Willis McGahee is, do you? Yes. No. Okay. All right, so that's a little video on the major structures of the knee. Yep. And then we talk about just the general injuries. I guess ACL. We talked about ligament potential tears. Remember, ligaments connect bones to bone. And there are tendons around there too that connect the bones to the muscles around there. But typically it's soft tissue like a ligament or those little cushions, the meniscus. So that's good. Yeah, that's knees.